Welcome to the Everything Cancer Podcast. This podcast is intended for survivors, those who love them, healthcare providers, and leaders of cancer support organizations. Our guests offer insight into the honest survivor experience, how challenges are met head-on, and where blessings are discovered. We cover effective self-advocacy on the bumpy road of cancer survivorship from the moment of diagnosis on. We talk about rekindling intimacy when cancer has changed your world. We are given behind-the-scenes insight into cancer care because understanding it better empowers you to advocate for yourself more effectively. We hear from leaders of cancer support organizations about their resources and how to access them or those like them. The Everything Cancer Podcast welcomes survivors who would like to share their journey and how they have met their challenges, providers who would like to share their empowering insight, and leaders of cancer support organizations who would like to share their stories and resources. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please note, the information shared on the Everything Cancer Podcast is not intended as medical advice. Please always consult with your healthcare team. The staff at Everything Cancer Podcast will not answer individual healthcare concern questions. Thank you for joining us, and we hope that you enjoy this episode and find it useful. Please do share it with other people if you think they'll benefit from it, and rate us on your favorite podcast platform. Thanks and take care. Hello, today's interview with the brilliant and fascinating Dr. Alique Topalian is divided into two parts. Dr. Topalian has an engrossing journey as a young adult and a pediatric cancer survivor. She has practiced ardent self-advocacy and shares much of how she has done so. She's also very busy at the forefront of state and national legislatures on behalf of all cancer survivors to have biomarker testing covered by insurance and also for transparency in copay assistance programs. Please join us for this fascinating and informative interview. Without further delay, we are on to part 2 of Dr. Topalian's fascinating interview.
But what happens next is it leads us into House Bill 177. So House Bill 177 is the copay accumulator bill. So a lot of drugs that come into the market are very, very expensive. Too expensive for, an average human to be able to afford on their own. So pharmaceutical companies and also pharmacies have come up with copay assistance programs.
Right.
And these copay assistance programs, they give patients life-saving access to their treatment at a price they're able to afford. But there's a couple problems about this. So, for example, my drug is $10,500 a month after my insurance, before my copay assistance. Before insurance, it's about $30,000 a month. And there is no generic version. And my pill is oral. The only other version of it is an infusion. So I would need my port back in, and I would be tied again to the cancer center on maintenance chemotherapy.
Right.
Compared to now, where it's 2 weeks on, 2 weeks off, an oral pill. I do it from home. Yes, I have the side effects, and no, they are not fun. But am I able to live my everyday life and work, especially since I'm able to do a lot of my work from home? I am fully able to manage my life. And I don't think that would be the same if I was still going on infusions, because honestly, I would be tied to the cancer center.
Right.
And I have access to this drug through the copay assistance program. And what happens, though, is at the end of the year, or once you hit a certain dollar amount, these programs expire. And then what are you supposed to do?
Right.
It runs out?
Stop your treatment? No.
Exactly. So, I mean, it was true. It was my first year being on the drug, and it ran out in November. And I remember I was on the phone with the pharmacy, and I was just crying. I was like, $10,500? Where am I supposed to come up with this much money to just stay alive? Like, this is after insurance. Like, what do I do? And I'm just crying. And he ended up starting my copay assistance for the next coming year early. So then I spent the next year just holding my breath. When's it going to run out? When's it going away? When's it going to run out? I don't know. When's it going to hit this time? And it's not a good feeling. But the other part of it is, even though technically my insurance is getting billed for that drug, and I'm, you know, there's this $10,500 copay that goes away. One, I don't really know where that money goes, but it does not count towards my deductible or my out-of-pocket maximum.
Yeah.
So my out-of-pocket maximum is $10,000 a year. And so far this year, I've already spent about $4,000 going up to $5,000. Because I've been having a lot of really bad complications. And I'm actually, my maintenance is paused for the moment, which I think is why my copay assistance didn't run out.
No.
But it doesn't count towards that. And 1 month could have wiped out my entire yearly out-of-pocket max, or even a portion of it, even if it's not all of it, you know? So that's something else that we're advocating for, is for this to count towards patient deductibles, and to actually not have the ability to hit a cap where it runs out and you just get it cut off.
Right.
It's not fair.
It isn't. And it's a very complex process, because I used to be involved in that process when I was a case manager for an insurance company.
Oh, wow.
And it's very complex. And when you try to explain it to people, they're already overwhelmed by what they have going on or their diagnosis.
Exactly.
And then all the hoops that someone needs to jump through.
Yeah.
I mean, we're very thankful that the copay assistance programs are there. And just like other drugs, eventually those costs will drop, but it's getting to that point. It takes years, but also it is life-saving medication.
Yeah.
And I feel like, well, it can be addressed in the legislative system. I'm sorry to see that it's finally there, as opposed to us having to mandate for it to occur.
Exactly. But that's also what, for both of these things, that's what the holdup is. Because a lot of lawmakers believe in free market and don't want to mandate things. And it's like, that's where we get, this push back and forth. And, I had someone say to me yesterday, well, what if we put in the medically necessary clause? And I said, that's what they got me on, though, was the medical necessity clause. Right. And it was medically necessary. And also, who are we to decide what is medically necessary? A patient's doctor should be the one deciding for that patient in their case. My oncologist, she did the most thorough workup of anything I've ever seen. She is one of the most incredible humans. I'm so thankful for her. I felt so safe, and I trust her opinion over literally anybody else, anyone. Even now, I've been having problems with fever of unknown origin for 4 months, and she's still here. And my adult oncologist too, they're both still there, just helping figure out what's going on. And that's who you want to say what's medically necessary for you, because they know. Right.
And not a legislator who's not trained in that. I agree with you, but you always get the disclaimer that just because something is determined to be medically necessary does not guarantee coverage either.
It's horrible, though.
Yes.
But I know. It drives me crazy.
Yeah.
I think one of the most confusing parts of all of this is the financial side of it. And I'm an advocate. I'm a researcher. I can tell you, I am lost in the healthcare finance side of things with insurance, and it's exhausting. It's the worst.
It is. I do believe that as pharmacy benefit managers are held more accountable, we'll see a lot more transparency with that.
Yeah.
I have that hope. And I honestly believe that's what needs to happen is transparency with pharmacy benefit management, with where we are right now with treatment of so many different syndromes through the various pharmaceuticals that you've just been talking about. Right. And so that transparency, I believe, will make a big difference. And the transparency with the copay assistance, how it's set up, how it's run, how it's administrated over through both the insurance company and the pharmaceutical company. And I'm hoping it's going to be a lot less challenging for people to have access to the pharmaceuticals that make a difference. Ultimately, that access is going to drive down the cost.
Exactly.
As it's used more and it's produced more, it will drive down the cost. Right. And I think we'll see a healthier population too. Yep. And I know I'm preaching to the choir there with what you do, but I think ultimately it will end up costing less in terms of all the other things that can happen. And if we can avoid, if there's something that can be done to look at two different treatment options, and someone has a choice between, let's say, an allogeneic transplant or pharmaceutical that is targeted, the targeted one may be because of what you were talking about with all the other issues that occur with the transplants. The targeted one may be the one to go for. And
that depends too on specifically your biomarkers, because most AML people are not able to get away without a transplant. Right. A lot of people are also able to find matches, so it's, I'm kind of in a very bizarre minority of my group even. And even people who do transplants do sometimes do targeted therapies as well as like part of their induction. And different drugs I've heard from different people about having like lower side effects. And, I will not say that my immunotherapy was like sunshine and roses. I actually like kind of struggled with it. Like I had all of the bizarre reactions that you can have. I'm always that person. Everything. Like I always. And so I should have known. But it was not easy. It was the most brutal part of my treatment. But I've heard other people where their immunotherapies sound very close to how I feel with my maintenance therapy. And my maintenance therapy is only even possible because of the biomarkers that made it possible. And, that's very, very new. They do it with transplant patients. They put them on this maintenance therapy too, because of AML's high recurrence rate. Right. They're treating it more like a chronic condition now. Yes. Like if I was older, I would be on it forever, but I went on it when I was 27 and I'm childbearing age. I just got married in October.
Congratulations.
Thank you. My husband's in med school, so we're, and I'm waiting till the 3 to 5 years when I'm done with treatment. But we want that in the future too. And they don't necessarily know what a drug like that would be for the rest of your life as a 27-year-old compared to, the typical age of AML is around 65.
So you bring up a really good point of 27, and that lets us segue into another arm of your of your advocacy, and that is for the adolescent and young adult population. So can you describe for us how that differs from the adult population, and what are the advocacy needs for the adolescent and young adult population?
I mean, I think one of the biggest advocacy needs for the adolescent and young adult population is for people to even realize that they're their own individual population to start off with, which I think is key. And I'm very happy even over the last year, 2 years, the increase I've seen in people talking about AYA cancers, but more younger people are getting diagnosed with cancer than ever before. And, there's a lot of different things that kind of relate to this, right? So, I was a pediatric survivor originally. And technically I was part of the St. Jude's cohort. So what we found from that cohort in research, it's a longitudinal study, and we found that 25 years after treatment, the pediatric survivors were having really bad late and long-term effects, and they were also having biological aging. So a child, this was the example that was used too. It was a child treated, for leukemia at 30 years old, technically like has the health of about a 50-year-old.
Thank you for tuning into the Everything Cancer podcast. We appreciate you being here with us. If you are finding this episode useful, please share it with others that you think would benefit. And don't forget to rate us with your favorite podcast platform. Please check out the show notes for more information and more information about our guests, links to their websites, and any other resources they've shared. We aim to make it easy for you to connect and learn more about the valuable insights shared in each episode. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please stay tuned for a brief word from our sponsors, and then we'll be right back to our episode. Thank you so much. Do you have a dry mouth that distracts you with that nasty feeling and taste? H2 Ocean has your solution, literally and figuratively, with its sea salt healing rinse. It's made from salt from the Red Sea, and it has other minerals that are beneficial to you in it. It also has lysozyme enzyme, which is soothing to the inside of your mouth, and xylitol, which makes your mouth water. It's very mild in flavor, yet refreshing. Does not make you suck in your cheeks like often happens with other mouthwashes. And it stays with you. Other mouthwashes, they're gone in 10 or 15 minutes. This has stayed with me for a few hours now, and it's great. I plan on using it before every podcast episode to keep my mouth moist without taking distracting sips of tea and so on while I'm talking. The links to the H2 Ocean Sea Salt Healing Rinse will be in the show notes, and then a QR code also on the YouTube version of this podcast. It's excellent to help rinsing with chemo mouth or irritation in your mouth from radiation, but mouth sores and just general everyday use. I find it really pleasant and really helpful to use. I hope you do too. Thanks. Wow.
Yeah, and I remember sitting in that talk and I was like, oh God, like, so then what happens? What happens? So,
yeah.
Not only that, but I ended up relapsing during that 20 to 25 years. So not only am I in that time period of being really high risk for the pediatric complications, now I just got absolutely blasted again with chemo and immunotherapy, and now this chronic chemotherapy, and it has a lot of different effects on you because AYAs are in a different phase of life, and
yes.
they get broken out into groups, and I don't claim to be necessarily an expert in the first A of the AYA,
adolescent,
non-adolescent, but I was a survivor who went through those things, so I do understand the complications of like still having to go back for your visits to the cancer center and things like that while you're in your teenage years and constantly looking out for those late and long-term effects like I was doing. So I did have some of that, but the YA, getting diagnosed at 27, I had been with my now husband for 4 years. He was the one who was with me when I got diagnosed. I got diagnosed living in Cincinnati. My family doesn't live in Cincinnati. My family's in Cleveland. I felt like I was on the cusp of my career. And I remember the day I got diagnosed, and this is also very unhealthy and probably going to show you a shift in where I was then to now when I talk about being my full self. And I remember all I was thinking the day I got diagnosed was like, this is literally going to ruin my career. I'm going to have to take this time off, and I'm not going to be where I want to be and I'm going to be behind. And technically, I mean, I am. Like, I'm not officially faculty. You know, I'm a research scientist, which is a, you know, different term in the academic world, still staff level, but working towards faculty. But it was horrifying to me. And then I remember after that, I looked at Max, and when we left, I even said to him, I'm like, you know, you don't need to stay around for this.
Oh my
We're
gosh.
27. Like,
Yeah.
this is not a normal 27-year-old thing. And I mean, you can back out anytime you want, but like, I'm giving you the full out right now. And he was like, you're absolutely insane. Get back in the car. It's cold. Like, what are you talking about? And I'm very thankful for that. But, you know, even just having that conversation, or the conversation of when I finished treatment or going through treatment and us talking about my fertility, we weren't even engaged yet, you know, and we're having these conversations.
These really deep conversations.
I'll never forget, the social worker walked up to me when I was in the hall with him and started talking to me about like my like living will. And I was just blown away. I'm like, I'm always with my mom. Okay. First off, like, my mom was living with me at the hospital. The only time she left was when Max was there with me. It was the only time she would go home. And you waited until she was gone and he, like, my partner, not my fiance or anything, is here. I was so mad. And yeah, with work and figuring out like disability, and I didn't have short term, I just had long term. And how do you file these papers, and how do you do all of these things? It was just so much. And I went home. Like, I left Cincinnati, I went back to Cleveland, and was treated there so I could be with my family, because I couldn't take care of myself, and I didn't want Max to have to do that. And those are things that AYAs are facing. You know, they're in this period of life where they are putting in the building blocks of their education. They're in college. They're, you know, they're moving on to different phases of life. They're starting relationships, starting families,
right,
building careers, figuring themselves out as a person. And then you throw cancer into the mix. And, you know, most people, like, I was on my mom's health insurance until I was 26. And I felt so gypped that I hit 27 and then I got the cancer, you know?
Of course.
And, like, I was like, of course. Like, I start paying for my own insurance, and this is what happens. And I'm just very thankful that when I was signing up for benefits, for some reason, I just decided to elect in for all of them. And that ended up saving me, because I had signed up for disability and didn't even realize I had.
Right.
And, you know, I had talked to a lot of my friends, and they're all like, oh, no, I don't opt in to any of that. And I'm like, honestly, you should, because we really don't know. Just because we are young and healthy, we're not actually always young and healthy.
Right. But you kind of alluded to a point there too at the beginning of our conversation of how for an entire year you had exceptional fatigue, you were having headaches.
That started in August.
Even though you had your history, I think because it was such a long pause, nobody really looked at you as potentially having cancer.
Part. Okay, so I want to hear the actual worst part of this story. So I had gone for my annual in August, beginning of August. They did labs. They were a little bit off, but not really concerning. But they told me I was 22 years in remission, and that I no longer needed to come back for survivorship visits anymore, and that I was 100% cured, and there was no chance of my cancer ever coming back. And I called my mom, and I was crying. We were so happy. Like, it was like this day we had been waiting for forever. And then a couple weeks later, I fainted at work. And that was really the start of the onset of all of the symptoms that continued to get worse and spiral until March. And when I finally ended up going, I actually ended up going to the gyno because I was bruising and thought I was anemic. And I asked for a CBC and diff, and she said that she thought I was overreacting and I should just take an iron supplement. And I said, no, I want a CBC and diff, because growing up, when anything was wrong with me, whether it was a cold or anything at all, mom made sure I got a CBC and diff because she was always very paranoid. Right. So I knew, if I see bruises, this is what I'm supposed to do. I've been told that since I was 4. And I'm asking for it, and you're telling me no. And I want it indicated in my chart.
It's a blood test.
I want it indicated in my chart that I'm asking for a simple blood test, and you are refusing to give it to me. Then she's like, fine, I'll order it. And my results came out at 10 p.m. that night. And I had like 14 platelets, like 19 platelets, I think.
Oh my God.
And yeah, it was absolutely, like, I literally could have hit my head and died and had no idea. What
been in a car accident.
And I was fainting a lot.
Yeah.
So
you could have hit your head.
Yeah. Not a very good combo.
No.
Yeah, but just the fact of how long it took to get diagnosed, and even the day it happened, that it was still getting put down on, still saying, oh no, not something we need to consider.
Right. But, so I hear that over and over again, is people in the adolescent and young adult population are diagnosed late because their symptoms are attributed to everything but something serious.
That's how come they've got like higher rates of morbidity and mortality. Yes. Because they get diagnosed later, their symptoms get diminished. Mm-hmm. And everybody, it's the same thing as me, where we get misdiagnosed with multiple co-occurring conditions at the same time. And it delays it even longer. And that's how come more of us are delayed at like stage 4 and advanced. Right. And it's not good.
No, it's not.
I mean, I still had a hard time I couldn't get my mammogram covered last year, even though I've had anthracycline exposure. Because like anthracycline chemotherapy makes you more high risk for breast cancer. And I've been having I had swollen lymph nodes in my armpits. So obviously we're going to send you for a mammogram and ultrasound, And yeah, I had to fight that too. And it's just, it's frustrating. And I think that the thing that I tell people the most is that you know your body. Mm-hmm. And you need to pay attention to it. Mm-hmm. And and I do wonder if it would have been different if it wasn't 2020 into 2021. Like, it was August of 2020 when it started. Mm-hmm. So
who knows? I mean,
but you know your body, and you need to advocate for yourself. And if you believe something is wrong, you need to keep fighting. And if the doctor who you have at first isn't fighting for you too, then they're not the right doctor for you. And this isn't the thing about the fight against cancer. This is you fighting to get your care.
Right.
Make sure that you're being heard. That is a fight.
Right.
Because sometimes you need to scream it from the mountaintops. And, I feel like now what's been happening with this fever, and it's been amazing because people have been listening, and we're literally going body system to body system, just trying to figure out what's going on. And I feel so empowered that I have a very, very good team between multiple institutions who are collaborating together, because I basically live in 3 cities.
Yeah.
So I'm not an easy person to deal with. I live in Toledo with my husband, who's going to medical school. I work in Cincinnati, and I'm from Cleveland, and my primary oncology team is based in Cleveland. So I am all over the place, but they make it very, very easy, and I'm thankful for that. But I did not have that before.
Right. I'm glad that that you have a great team behind you and you feel that sense of empowerment
Yeah.
and sense of being heard. So what would you say to people who feel like they are, you said, your body. And if you're not with a physician who's listening to you, it's time to find a different
Yep.
physician. Is there anything else you would like to add to that for someone who feels like they're not being heard for their symptomology?
I mean, there's different things that you can do. So like when this was happening, I started recording my
Yeah.
symptoms and
Right.
documenting them because people kept asking and I was saying it to them, but they didn't seem to be actually getting it. And
Right.
somehow putting a piece of paper in front of them seemed to make them listen
Right.
more.
Data makes a difference.
You know,
Hard data
and it
makes a
helped
difference.
me keep things straight
Right.
too. And
Right.
I also would prepare questions before I would go in because sometimes when I would get in, there was so much information to say that I get flustered. Honestly, the best development has been having someone go with me
Mm-hmm.
as a backup,
Mm-hmm.
like my husband or my mom, you know, or when I was impatient, like my dad, my aunt too. I had a very involved family and group of friends, and sometimes you need another set of ears.
Yes. And
But
another mouth.
also, don't let healthcare systems bully you into something you don't want, and don't let them bully you into believing that something's not wrong. Because even recently, I had an experience with it wasn't even my provider, but it was someone who worked under my provider, and I just didn't want to be at that practice anymore. And I wanted to transfer my care to another provider in a different department at the same institution. And they told me that I had to call my provider and say that I wanted them to relinquish my care to the new provider before I was allowed to go see them. And I was actually infuriated because I was also kind of upset about the situation happening to begin with, which is why I wanted to transfer providers. And now you're going to make me talk to them. And I almost didn't do it, but I did. And that was fine. I actually ended up getting the voicemail. It was not a big deal. And no matter what, you're allowed to change your provider for whatever reason you want. I didn't even give the real reason. I was like, I just want to. That's it. This is just what I want to do. And yeah, just do it. And I felt much better. And I like my new person. So, sometimes it's hard to fight back against a healthcare system. Like I felt very, very, very small when they did that to me. Very small. Like I called my husband crying and I was like, I don't want to call the doctor and say this to them. And I couldn't even believe it too, because I was talking to my colleagues, because this is a different place, and everybody at my institution was blown away that that even happened.
Right.
So it's not something that happens everywhere, but just fight for yourself and change providers if you want.
Right. Right. I will caution people, if you're currently on treatment, do not have your treatment delayed by the change.
No.
Work to stay on treatment until you get switched, so that you never have a gap, because that can affect optimal income. Right.
This is for not oncology care either.
Right.
My primary oncology team is steady. It was a different kind of provider.
Exactly. I get it. And but I just want, for our listeners, just be careful. Don't have a gap in care or a gap in treatment because of changing. So your time with us has just been absolutely amazing, and we could talk for hours. And you make me want to reach out to so many organizations now. But Dr. Topalian, is there anything that we haven't covered here that you would really like to share?
No, just thank you so much for having me. This has been such a great experience. I'm so happy you reached out. And if you ever need help again, I'm happy to assist.
I would love to have you come back to talk about biomarkers sometime. I think that would be really interesting. I think a lot of our listeners would really enjoy that. So I'd be happy to book that with you. And I appreciate you offering. And if you think of anyone else that
I actually
could be
might
here,
have an idea
okay, great.
for someone. So yeah.
Great. And I'm really looking forward to talking with your mom about the Gathering Place.
Yes.
It sounds like an amazing place. I love the local cancer support organization I'm with, and the Gathering Place just sounds so, I have so much appreciation for what they do and what your mom does. So I'm looking forward to bringing her here to talk about the richness of the programs they have and what they have to offer.
It's a great program. And they do a lot virtual too. So they actually have people even use their services out of the US now too.
Wow.
Which is really cool. So
that is really cool.
It's nice to increase the accessibility of these things.
It is. Thank you so much. I look forward to having you back. Anybody you want to suggest, we'll welcome. And I would love to have you back to talk about genetic markers and biomarkers and what they mean and how they can impact your treatment decisions. I think that would be great.
Yeah.
Okay. Thank you so much. Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guests, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. And for anybody that you have invited to join us, please reach out if you would like to be a sponsor. We would welcome you. Thank you.